Welcome. My name is Peter Strong. I'm a professional psychotherapist specializing in mindfulness therapy, which I offer online via Skype for treating anxiety disorders, including agoraphobia. So I'm often asked if there is a cure for agoraphobia. Can agoraphobia be cured? And the answer is yes, it can, as long as you take a very strategic and a disciplined approach to overcoming the underlying anxiety of agoraphobia. The biggest problem that I encounter is that people tend to get into patterns of avoidance. They tend to try to avoid any triggers that might create anxiety. But you have to understand that avoidance itself is a form of anxiety-based reaction, and that simply feeds the underlying anxiety. So taking a disciplined approach that against avoidance is very important. You must not avoid your anxiety. It will not help it heal or change if you do. So we have to learn to work with our anxiety, but in a very skillful and effective way, and that's where mindfulness therapy comes in. It's a very effective way of working with anxiety and reducing and eliminating anxiety so that you can restore your freedom to move that you had before the onset of your agoraphobia. So the methods that I teach are basically mindfulness-based exposure therapy for agoraphobia. So this is where we set up a series of challenges, progressive challenges of increasing difficulty, that you work through in a very strategic and focused way using mindfulness. And I will teach you how to work with your anxiety using mindfulness during these online therapy sessions. But the basic idea is that you imagine doing each of the challenges. First of all, that you prepare and train for each of the challenges by imagining doing the challenge and watching for any anxiety reactions that might occur. When you find those anxiety reactions, you then start applying mindfulness to change the way that you relate to that anxiety. This is crucial. The real problem is that we become totally identified with that emotion. We become contracted and we become overpowered by that emotion. We have to learn to train with it so that we can stay present with the anxiety and not become overwhelmed by it. So this is training out of the habit of reactive identification. That's the first necessary step for change. So we do that by imagining the challenge, looking for the triggers and the anxiety that gets triggered, and then working on changing our relationship to that anxiety, where we remain as the observer, as that part of yourself that is much, much bigger than the contracted anxiety reaction itself. So we train to be the observer, seeing the anxiety as an object, which is what it is. It's an object that arises in the mind when it gets triggered by certain conditions, and it stays in the mind for a certain period of time and then usually it will dissipate. It may reoccur again, but it always undergoes this pattern that's common to all mental objects. They arise, they exist for a while, and they pass away. Now, when we identify with these emotions, that stops them passing away. It basically prolongs them, and it reinforces the anxiety. But when you start to develop an objective, mindful relationship, observing the anxiety without identifying with it, then you stop feeding that anxiety. And the anxiety will undergo change, and it will undergo healing. And so what you're doing is you're cultivating pathways of healing that become more and more effective. And that healing process for that anxiety becomes faster and faster the more times that you expose yourself to that anxiety, but then cultivate being the observer instead of becoming overwhelmed by the anxiety. So that's the first part of our training, is learning how to stay present with the anxiety without reacting and without identifying at all. That's very important. And you do that by deliberately accessing that anxiety, which is why we do this meditation essentially before the challenge. The meditation is a process of exploring our reactions, exploring our emotions as the observer, and learning to stay present without reacting and without becoming identified. So we train with the anxiety to help it heal. Firstly, by staying conscious as the observer. That's so important. The second thing we can do when we're meditating before the challenge is to develop a more compassionate relationship to the anxiety itself. We see the anxiety that gets triggered as being like a child. That child is unable to heal its own suffering because it doesn't have sufficient consciousness to be able to do that. So it goes to its parents when it's suffering for comforting and for help and reassurance and so on. We need to establish this same kind of relationship internally with our anxiety. To see that anxiety not only as an object, a separate object, but to see it as being like a child that's in pain and that needs our help. Now, when you're able to maintain that objective consciousness, then you become like the parent, and you are now in a position to be able to actually help that anxiety heal. If you get caught up in reactivity, you become completely impotent and unable to help that anxiety heal. But when you are not reactive, then you can begin to explore how to help that anxiety heal. And by developing this strong internal relationship between what we call your true self, which is the observer, that objective consciousness, and the little self, which is the anxiety, when that relationship is strong, then healing is promoted, and it happens very effectively and very quickly in proportion to how strong that relationship is. There are other techniques that we use during our preliminary meditation training on the anxiety, and these often involve working with imagery. it's a very interesting observation that all emotions are based around internal imagery. That imagery determines the intensity of that emotion. So if the anxiety is very intense, chances are the imagery is going to be very large, very close, possibly very detailed in color and texture and other properties that make that imagery very powerful. And when the imagery is powerful, the emotion is very intense. So we uncover this imagery, we look at it during our meditation, and we see if we can discover ways of changing that imagery. Because when you change the imagery of an emotion, you are directly changing the emotion itself. For example, simply exploring how to make the image of the emotion smaller will decrease its intensity. Moving its position will decrease its intensity. There are lots of different ways of working with that imagery that can be amazingly effective. So again, this is part of the training. We're training the emotion to have different imagery, to change its imagery. It cannot do it by itself. It has to have your guidance, your conscious presence to be able to do that. So working with imagery is a big part of our rehearsal meditation. So when we've trained with the anxiety, and when we can imagine doing the challenge without any anxiety, then is the time to do the challenge. And all we have to do during the challenge is stay present, stay mindful, stay conscious. And if anxiety gets triggered, then your training that you will have done beforehand will essentially neutralize that anxiety in real time. We can also meditate after each of our challenges to see any anxiety that may have arisen during the challenge, and we reprocess it in the same way. And then, of course, at some point after taking a break, we repeat the challenge until we can do the actual live challenge without any anxiety at all. That's our goal. And then we move on to the next challenge in our list. If you take this very strategic, mindfulness-based approach to exposure therapy, you'll see results very quickly. And most of my clients see dramatic changes within a matter of weeks. Once you start applying these techniques yourself, that is what's most important. I will teach you in great detail exactly how to do this. I will teach you how to apply mindfulness to overcome your anxiety. I will teach you how to set up a schedule of exposure challenges. I will teach you how to meditate and train with your anxiety. That's what we do during these sessions. So if you'd like to learn more about this approach for overcoming your anxiety and curing your agoraphobia, then please contact me and we can schedule some Skype therapy sessions. So please contact me now. Thank you.